In rounds last week, Dr. Andrea Brock talked about cervical myelopathy. And so let's talk a little bit about what is cervical myelopathy, how is it diagnosed, and what you should know about it. In the spine, we have the spinal canal and then the neural foramen, and the brain is housed in the skull. So basically the entire nervous system, other than the peripheral nerves, are encased or surrounded by bone and discs and then the joints. Spinal stenosis is when a narrowing occurs in that canal, and sometimes that narrowing occurs around a nerve and we get pain radiating down an arm or pain radiating down the leg. However, when the spinal stenosis is around the spinal cord, the symptoms can be very different. And cervical myelopathy is basically when we have patients with pressure or stenosis around the spinal cord in the neck. The neck is subject to arthritis. We all can move our necks, and there's lots of joints and areas where bone spurring and disc herniations can occur. What are the symptoms of cervical myelopathy? Patients that have cervical myelopathy oftentimes are mostly affected with their hands. For example, they're at dinner and they drop a fork, or they have difficulty buttoning the buttons on their shirt, or their handwriting isn't quite as neat and tidy as it used to be. Fine motor movements are affected. Grip strength isn't quite as good. Patients may notice that their balance is a little bit off. These are subtle symptoms of cervical myelopathy. What are we looking for on physical exam? Well, one is the strength in the hands especially, and other muscles in the body. We also check reflexes, and reflexes can be abnormal in patients with cervical myelopathy. On MRI scan, we're looking for pressure on the spinal cord. And then really the discussion becomes, if there is pressure on the spinal cord but no symptoms, what should we do? And if there are symptoms and pressure on the spinal cord, what should we do? And what is the natural history? Very rarely should a patient feel like they have to do something when there's narrowing around the spinal cord. Sometimes they'll hear, well, if you fall or you get in a car accident, you're going to be paralyzed. And I don't think it's as dramatic as that. However, it's worthwhile to have a discussion with a skilled provider if there is narrowing around the spinal cord. If the patients have symptoms and there's narrowing, I think it's probably worthwhile to consider surgical intervention, because if things are already going down a course of being symptomatic, we don't have as much of an ability to make it improve. We're mostly looking to prevent it from getting worse. When we do surgery for cervical myelopathy, we're usually doing some kind of a fusion surgery on the neck, maybe a disc replacement in some cases. Everybody's pathology is a little bit different, so that's something that you would counsel with your surgeon about. If you're having signs or symptoms of cervical myelopathy, especially balance issues, weakness in your hands, difficulty with fine motor movements, consider seeing your provider, checking an MRI, doing a physical exam to understand what you may want to consider doing for treatment.